One. Tim Bennett here from the Cortland Voice, and I'm here with Dr. Alec Macaulay from Cayuga Health. Doctor, how are you today?
I'm doing great. How are you?
Good. So, doctor, tell us about yourself and the discipline that you're in over there at Cayuga Health.
I grew up in Oneonta, New York, not too far away from Cortland. I think one of the things that drew me to my future field of orthopedics was playing sports. I played football, had some broken bones, had some knee injuries, which we'll get to, and I think that drew me to orthopedic surgery, which is what I do now. After growing up in Oneonta, I went to school at Cornell. And then once I was done with all my training and everything, I liked the area. So I decided to move back here to practice.
Okay. So, I think it was meant to be for you to serve the Cortland area. You were born a Red Dragon. I know it was the Oneonta Red Dragons, but it was meant to be. So you by far are a Red Dragon at heart. Okay?
That's right. Runs in the blood.
In the blood. Okay. So as far as what you do at Cayuga Health, once again, you said ACL is correct?
Yeah, so I'm an orthopedic surgeon. I mostly do lower extremity types of injuries, so knee injuries, ankle injuries, leg, foot, that kind of stuff. So yeah, a lot of which are sports types of injuries like an ACL.
Okay. Now I know what an ACL is because unfortunately I hurt mine playing basketball years back. But what for the community watching, what is an ACL and how does like an ACL injury occur?
Yeah, I feel for you. I tore my ACL playing basketball as well. So with you right there. So the ACL is one of the four main ligaments that stabilize your knee. So the knee is a joint that's just supposed to kind of rotate back and forth. And you have these ligaments that hold the bones together and allow that joint to move in that way. And if you tear the ligaments, it can render that joint unstable and it can cause pain and having your joint shift around and all sorts of problems. And the ACL is probably the main one we think about when it comes to the stability of the knee, because it's the most common one that people end up injuring playing sports and then need, surgery for.
So how do you diagnose it? So a lot of people feel knee pain if they slip on the ice or they bump it against a table, or how do you know when it is the ACL? Like, how are you diagnosing that? Is there something they should know, or when should they come see you?
Yeah, it's a good question. A lot of it is getting the story from the person when I'm seeing them. A lot of times people will describe like a twisting injury to their knee and they felt or heard a pop. And then all of a sudden their knee hurt and swelled up on them. That's usually a bad sign. That's kind of the first thing we look at is what the person describes. A lot of times these aren't contact injuries. We always think of the football player who, takes the helmet to the knee and everything gets torn and they're out for a year. But, honestly, most of these are what we call non-contact injuries. You're just, kind of at the end of a soccer game and you're tired and you go to pivot and your knee pops and gives out. So if you feel or hear a pop, it swells up, you have pain, probably a reason to come in and see us. Once you see us, we can take a look at the knee and try to see if it feels stable or unstable. We can try to get a good exam. And then at the end of the day, we usually get an MRI if we're concerned that you may have torn your ACL. And that allows us to see the ACL directly and see whether it's torn, partially torn, or okay.
Okay. Now I know how long it took me, but how long does it normally take someone to recover from an ACL injury? I imagine it ranges. I don't know what the factors are that change that range, but
yeah. So, just because you tore your ACL doesn't necessarily mean you have to have surgery. Not everyone needs surgery for their ACL. It largely depends on the kind of activities you like to do. So the ACL is really important if you're doing cutting and pivoting types of activities, sports, soccer, football, basketball, volleyball, these sorts of things. You really need an ACL. But some of my patients who maybe aren't as active, they just want to walk the dog around the block or maybe do some jogging or hiking, they might not need a new ACL. They might be able to get by without an ACL and keeping the knee strong and physical therapy and that sort of thing. And if you go that route, the recovery is fairly quick. If you do end up having surgery because you are maybe interested in getting back to, sports that require those cutting and pivoting types of activities, it's about a year recovery all in. The surgery doesn't take a year, obviously, but all the rehab and the building up your muscle and getting the confidence back to using it takes about a year.
Oh, wow. What are some ways to prevent ACL injuries from occurring? So, I mean, I know you spoke about turning, or is there a certain like exercise, or even if they feel good, should they wear a certain brace or physical therapy ahead of time to stay on top? Like, what would you say?
Yeah. So, probably the best thing you can do is when you're going to be playing sports, get ready for the sports season appropriately. I mean, I see so many injuries where people, decide they're going to go out for the soccer team and they show up on day one out of shape, hadn't been doing any running, hadn't been doing any agility work. And that's just a recipe for disaster. So if you're going to be starting a new activity or starting a new sport, you want to take some time to kind of ramp up and build up to it. Get in shape, build up your muscles, do some of the sport related activities ahead of time before it's a game situation. So that's really important. Another thing is a lot of these injuries happen as you get fatigued. So, maybe it's early in the season and it's the fourth quarter and you're tired and you're kind of pushing through it and your mechanics get off. That's when a lot of this stuff happens. So, not pushing through kind of fatigue and pain, especially early in the season, is really important. They do have, exercise regimens that you can do to try to protect your knee. A lot of it is focused on the way you plant, the way you land when you jump, these sorts of things, because there are, certain mechanisms that tend to put more stress on your ACL. So there are programs you can find online, with trainers, with physical therapists to try to build up your knee to prevent these types of injuries. Certain demographics are just at higher risk for this too. So it's much more common in females than males. Some theories on why this is, and we don't know entirely, but it tends to be more common in females. It tends to be more common in cutting and pivoting sports, like, obviously, but, soccer is a big one. Women's soccer, for instance, is a very high risk. So these are, you can look at some of these higher risk demographics and, think, okay, maybe this is a team that really would benefit from one of these programs to try to build up the knee ahead of time and prevent these types of injuries.
Do you see it also with maybe, this is just a guess, maybe depending on like somebody's nutrition, whether it be obesity or maybe someone's age, like maybe because like when you think of a little baby or a little kid, they run and they bump into everything. So if I say the opposite, someone elderly, do you see it a lot with them too, the elderly or obese? Or
not as much. I think largely because they're not as active.
True. I didn't think of that.
Most people, as they get older, as much as they don't want to admit it, become a little less active and a little less athletic, myself included. And, certainly, if you're out of shape and you're not exercising, you're probably even less likely to be doing the types of activities that are high risk for an ACL tear, like, playing soccer or something. So we don't see it as much. It tends to go down as you get older. This really tends to be an injury of high school, college age, 20s, 30s. As you get into your 40s and 50s, even though that's not old, it does tend to kind of go down in incidence. Yeah.
Gotcha. As you probably get to your 40s and 50s, I bet it might be like either back or Achilles, or maybe
that's not to say other things don't start cropping up. A lot of other things start cropping up. It's just less commonly ACL tears. You start to have issues like arthritis and tendonitis problems, and Achilles ruptures go up in the what we call weekend warrior crowd. Kind of the you're in your late 30s, 40s, and you're working during the week, but maybe on the weekends you're in a basketball league or something. So there's certainly other injuries that tend to crop up as you get a little older, but ACLs are not one of them. They tend to actually go down.
Gotcha. And that's why we need to stay fit and stay ready so that we can keep the ACLs ready for early contact, the turning, and everything, as you said. Now, when something like this does happen, are they going to need a referral? Do they need to, stop at, your with their primary care physician or Cayuga Health urgent care, or can they go right to you?
Yeah, usually most insurances don't require referrals to see an
Okay.
orthopedist these days. That used to be the case. And I think insurance companies kind of finally realized it was a waste of time for people to wait to get into their primary care just to get a referral to wait to get in to see the specialist. So you can always check with your insurance if you're not sure, but most of the time you can, call an orthopedic office directly. You can certainly call our office directly and we'll get you in and get an appointment. We do in Cortland, we do have actually a walk-in clinic for these types of things, Monday through Friday in the afternoons. So, if you're concerned about the weight or something, that's always an option too. And we see same day orthopedic injuries 5 days a week. So most insurances don't require referrals nowadays, so you can kind of cut out the having to wait to see your primary care. But if you're worried about that, you can always call your insurance and check.
Okay. And normally I let the physician get like a last word or a last comment to the community. Today, we're going to call it the Red Dragon Reflection. We're going to hear. We're going to hear a closing word from you, doctor.
I feel like it really has to be profound.
Boom. It's your time to shine.
Well, thanks for having me. I appreciate it. I've been coming to the Cortland area for 3 or 4 years now. It's been great. I've enjoyed working with the community and meeting a lot of people there and helping them with some of these problems. If you have any questions about, you think you may have had a knee injury and it could be an ACL or anything else, we have other physicians in the group who come here who do upper extremity injuries, or as I do kind of lower extremity injuries. So if you have anything, you think might be a problem or you want evaluated, give our office a call. We're happy to get you in and see you. But yeah, thank you for having me. I appreciate it.
For sure. Thank you for joining us, and to everyone watching, thank you for joining the Cortland Voice, or for watching our video, and thank you for choosing the Cortland Voice, I should say. Have a blessed day.
You too.